Hi, everyone. Welcome back to another episode of Heart to Heart, a IGTV and YouTube series by myself and my partner in crime, Dr. Mbreen Mohammed, where we talk to today's physicians about their journeys in medicine and just getting to know them a little bit as people and, getting a look at medicine behind the curtain. So today we are very honored and excited to have our colleague, Dr. Alin Gragossian. So she's originally a Cali girl, like the both of us. From Los Angeles, and she graduated medical school from Lincoln Memorial University, DeBuss College of Osteopathic Medicine, and went on to do a emergency medicine residency at Drexel Honeyman, which was interrupted when she was hospitalized and received an emergency heart transplant in the middle of her third year of residency. But she has overcome, and she is now currently a critical care fellow at Mount Sinai in New York City. So you hopefully follow her on Instagram, where she does share a little bit of her journey there, but we are excited to hear more about it here on our Heart to Heart. So welcome. We are so happy to have you here.
Thank you for having me.
Of course. And just, we like to get started with everybody about what was your drive to go into medicine, and why did you choose emergency medicine and then a fellowship in critical care?
Sure. So everybody asks me this, and honestly, I didn't, so people are like, oh, it's because of your heart transplant? I was like, no, that happened way at the end of my career. I actually never had any medical issues or anything. I never knew anybody in medicine. I just kind of always liked it. When I was in high school, I volunteered I was just a volunteer in an emergency room. I was just an honor student and all that. So you had to do volunteering on the side. So when I was 14, I started volunteering in an ER, and that's when I remember the first thing that I saw was a forehead laceration. And I went home that day. I went home at 1 a.m. I was even I stayed 2 extra hours after my volunteering shift. And I went home. I was late going home. My parents were super mad at me. There were no cell phones at that time, and they were like, "Where were you?" And I just had fallen in love with medicine and emergency medicine. So I continued volunteering there, and I knew that I wanted to do something in healthcare. I was very open to everything. But overall, I liked emergency medicine. I was open to other fields too. And then when it came to applying to medical school, I ended up liking everything. And emergency medicine, I feel is a little bit of everything. And it kind of fits my personality. I'm an adrenaline junkie, and I kind of get bored easily. So I like just a little bit of everything in crisis mode, which is kind of what we are in EM. And so I don't know, so it was kind of a little bit of the stuff that I did in high school, and then my personality, and then it kind of all worked out. And that's how I got into emergency medicine. Critical care, I really liked when I was in medical school. So I realized it was a newer thing. So most of the time, critical care fellowships are done by internal medicine, or, you do internal medicine and then cardiology, or internal medicine, then nephrology, and then critical care, or palm crit, which is the traditional way to go. But emergency medicine opened up when I was a third year med student. It became the new sexy thing to do. And so I fell in love. I was oh, I want to be Scott Weingart, which is he's one of the cooler newer EM critical care people, and he had a podcast, and I was I think that would be cool to be able to not only do resuscitation in the ER, but be able to continue that management of the resuscitation in the ICU. So then I decided to do that after residency.
Yeah, and I think that we've seen this with others as well. Having exposure at an early age can really help shape us, but also keeping an open mind, right? Keeping an open mind through the different experiences that you have, and then also seeing how the field can change while you're in it. And that's one of the most exciting things. I think we both think about medicine, and especially our fields, but medicine in general, is that it's an ever-changing field. It's not static, and you can make it what you want, and pursue what you want. And your story is just another example of how one, early exposure is really important, I think, in continuing the pipeline of opening up doors for many people in medicine, but also knowing that you don't have to stick within a certain lane. You can explore, and you can pursue the things that you want to do. And so it's exciting to hear that that even your own personal journey, that was something that you were able to do.
Yeah.
Yeah, definitely.
Yeah, absolutely. And I just want to add to that, like Amisha's like saying, like, stick in one's own lane. I mean, I think EM and IM are notorious for for butting heads.
Yeah, I know.
I think EM might have that reputation with a lot of fields.
Yeah.
But that's okay. We love our EM doctors. They have to do what they have to do.
Right. I always say, but if you were having an emergency, where would you go?
Yeah,
exactly.
Yeah. And, I think we have also learned going through our training, and now just, I mean, if you didn't do critical care, you'd be an EM attendee. Now we can't live without each other. Everybody in the hospital, every specialty kind of relies on everyone else, and you learn how to work together. So in residency, when we would probably butt heads because we'd be like, well, why the hell does she want to have that patient accepted? And that patient should probably go home. And what's this freaking time limit thing that these people are like, harping about? But then you kind of just realize, like, no, like urgency matters and triaging matters. And like, you need to learn how to work together. And I think a lot of times, especially in training, because we're just so focused on what we're doing. And I still remember in IM residency, we had to do a couple of EM rotations. And like, after that, I was like, all right, you know what, mad respect to my EM peeps, because I was sitting there like trying to, like, you were talking about anemia before we got on here. And I was sitting here trying to do like the differentials of what anemia was. And the attending was like, this is not inpatient. Stop it.
Blood transfuse and like
admit, and just go. Like, it's not our job to figure it out. And I'm like, oh, okay. So you don't want to know if this is iron deficiency and where it's coming from and what's going on? Like, okay.
Right. Exactly. And there's benefits to that, because the whole point of ER is like, again, I tell people, I'm like, ER is not there to diagnose little things. Like ER is there to resuscitate. Like that's where our mindset is. Like we do a very like, we go in assuming the worst of a patient. Like we want like if there's an emergency going on, we're trying to treat that and that alone. And we're trying to resuscitate. And that's our mindset. That's the way we think for 3 years or 4 years during our residencies. So it's very different. Like, and the way we approach a patient is very different from the rest of medicine.
Right. Definitely. I think that's
like all of us understand that. Like once we go to a meeting, we all realize like, oh, like this person does this, and that's why that person does this, and that's why this person does this. So.
And I think that's the beauty, right, of medicine. And obviously, like Alin was saying, like we don't really think that way when we're in the middle of it, right? Just training, but then we learn to appreciate it as we go through each, month of training, year of training, and then become attendings and in our careers. But I think also to the general public, right? Like sometimes people don't understand, okay, how come you don't know what this means? And it's like, well, that's not my specialty. And yes, I was, privy to that maybe at some point in my life, but not every surgeon is a medical doctor. Not every medical doctor can do surgery, right? Even though we were exposed to different things. And that's why we can all, build relationships and learn from each other, right? So
exactly. Yeah.
So, Alin, obviously Amisha mentioned, in her introduction how, I'm sure your life was going absolutely just streamlined, not expecting any significant hiccups. You were almost ready to graduate from EM residency, and then boom, like you were hit with this crazy diagnosis. You almost died and you needed to have an emergency, heart transplant. You started this blog, which I remember, I never even met you. We did the same, we did residency and fellowship at the same hospital, but I was so enamored, with you, with your blog, and how you were just so incredibly real with how, you went through your day to day and in terms of your, from your initial diagnosis all the way, to your recovery. So I think one of the interesting things to bring up, and I say this because, we also follow you on Instagram, and there was a question thing that you had done recently about what patients, something about like what patients would want their physicians to do, or what patients would want their, healthcare providers to acknowledge. So knowing that you've gone through this whole transplant experience, like how has that changed you, as a physician caring for your own patients, especially in the critical care realm that you're in now?
Right. I like to start off by saying that anytime I get asked this, I say like, I don't think you have to go through what I went through to become a good physician. Like I wouldn't I wouldn't wish what happened to me upon my worst enemy. Like, I don't think a physician needs to go through an illness to become a good physician. But I do think that what happened to me gives me a little more empathy. And by empathy, I mean, like, I can, like, empathy and sympathy are a little bit different, right? Sympathy, you can sympathize with someone. Empathy, you can actually feel what they're going through because you've been through it. And I feel like I can actually like empathize with a lot of my patients, especially because I'm, ER and critical care, and especially because my patients are super sick a lot of the time, especially my ICU patients. Yeah. So having that extra knowledge of what it's like to be a very sick patient, I feel like just, it doesn't necessarily give me an advantage. I just know a few things differently than other people would. And to justify, like, I remember when I was going through what I went through, sometimes you start like justifying things, and like, I don't necessarily, I'm not like a spiritual person or anything, but like, just to make me feel better, I was like, you know what, like, in a way, like, this is kind of a blessing. Like, I should think of this as not every physician knows what it feels like to, what their patients are going through. Mm-hmm. So almost in a way for me to like justify what had happened to me, I saw it as like a good thing, I guess. Like, your mind does weird things when you're on Solumetrol or whatever, all that stuff that they give you. But I remember that's kind of what I thought, and that really helped me get through everything that I was going through. So, so in a way, I can like empathize a lot more with my critically ill patients. And in a way, like, there's little things that I know. For example, like, I remember exactly like what it feels like to get a chest tube placed. I remember exactly what it feels like to have a chest tube removed. I know exactly what it feels like to get an A-line placed multiple times because mine just kept, popping out. And I know exactly what the frustration is like, when the A-line gets like, it pops out and it kinks, because A-lines always get kinked when they're in the radial artery. So it's those little things that I know that, and I can do little things around to help, make the patient a little more comfortable. And it's not so much about me knowing specifically, but even when I educate other people, like, I always tell my co-fellows, I'm like, ask me all you want. And sometimes they're a little bit shy. Like, people, when they first meet me, they're like, you're a little open about it. I'm like, no. Like, I'm open about it for a reason. It's because I want doctors to like ask me about what it's like. And my co-fellows now are like, really like, now that they're like, hey, what did it feel like to get this? Like, should I do this? And should I like, I'm like, no, you know what? Before you do that A-line on this patient who's like super awake, give them like a little bit of Versed. It'll help. Like, I remember that really helped me. So it's the little things that I do and I can help others understand that I think helped me. And I think it also helped me get through what I went through. So.
Yeah, well, and I think, it's been so amazing to follow your journey, especially on social media where, I connected with you. And I feel like you said, just having that perspective of both being a physician and then being a patient, going through all of these things, at least for me, it gave a whole nother angle to a story, right? Like, we sit down and we talk to our patients and we hear about things, but then to hear what a physician's perspective of that same thing is, I think also allows for the medical community to connect in a way that, sometimes we are berated on, in terms of like, do we have enough empathy? Do we have enough sympathy? Do we really understand what our patients are going through? So I'm not, saying that everyone has to advocate their stories or tell about their personal medical history. Right. It's not about that. But I think for you, since you made that choice, it has, I think, opened up another perspective to those of us in the medical community to connect, right? And that leads me to my next question for you. You've shared your journey on Instagram and on Twitter, and you've used it as a platform, not only to educate, but also to bring awareness, I think, to different organizations, different issues happening, whether it be within medicine itself or with organ transplant. And where do you see your social media going? And how would you advise, maybe students, trainees, or other physicians to really build their platform if that's something that they want to do?
Sure. So I'll start the story off by like how it all started was, I was in the hospital. I was waiting for the transplant, and I'm sure you guys are cardiologists, so when there's a patient waiting for a heart, like, it was the weirdest time of my life, because I was just like, I tell people I was hoping that I would stay alive. Like, every night I was like, I hope I'll be alive when I wake up, because that's what and I told myself, if I stay alive and if I get that organ transplant, then I'm gonna do something with my life. And it became a joke, because I remember the nurses would come in and they're like, you're a doctor. like what else do you want to do with your life? And I was like, no, like, I mean, everybody could be a doctor, but like not everybody could like do some, like, I don't know. I just wanted to like do something with the voice, that I had. And so when I was when I was waiting, I waited 11 days because I was super sick. I tell people that and they're like, wow, you didn't have to. I'm like, no, it's because I was super sick. That's why I waited. So, I didn't wait that long. But in those 11 days, I started making this blog. And initially the blog was just so I can like post updates about what was going on, because I was getting like literally like hundreds of texts every day, like from family and friends and everybody. And I was just like, I'm just going to write what's going on and like post it. And I didn't even realize like it would go anywhere. Then when I started, like, people started like sharing it, and people were like loving, like, they're like, wow, it's amazing that you're writing all this. And I didn't mind. And I was like, well, if people are going to the blog, why don't I use it to do something with it? Well, so I got the heart transplant. And then afterwards, I decided the first thing I was going to do was use it to raise money for Donate Life America. And that was I think that was the first charity like fundraiser that I did through my blog. So not only was I using it to like express myself and write about what was going on, but I made like a charity fundraiser through it. And my goal was to raise like $2,000 by my first heart anniversary or something like that. And so it was just something that like happened. Like I didn't even mean, I was like, oh, I'll just do this and this and this. But I had that initial goal was like, I don't know what I'm going to do, but I'm going to do something. And that's what it turned into. So then when I realized that people were actually going to the blog and actually donating and actually listening to what I had to say, then I was like, wow, this is amazing. So now I can use it to not only raise awareness for organ donation, raise awareness for women with heart disease, and do this and talk about what's going on with me, then that's how it became what it eventually became. I think if anybody wants to, if there's a physician or, anybody in healthcare who wants to start like a platform like I did, it's all about just getting your story out there, and making sure that you find that audience who you really like, you connect with. One thing that I did was I tell people this because it was really hard to find heart transplant patients who were like my age. Everybody was like, and again, like, I love, older people and everything, but it's different to be a 30-year-old girl with a heart transplant. I have different issues than 75-year-olds with heart transplants. And so what I literally did was search for the hashtag heart transplant recipient on Instagram. And that's how I started meeting all these like other women who were with heart transplants. And, they connected through my blog and my Instagram. And like, then we all became friends. And like, so then I found that audience, and, all this stuff happened through social media. So if you can find that audience, find your goal and just kind of like go with it. That's basically what I did.
Yeah, that's incredible. And I think, we all have gone through different struggles. I mean, your medical illness aside, everyone has gone through a different struggle in, medicine. And that's one of the reasons why Amisha and I started this series, was really to highlight that, doctors don't have it easy, one way or the other. We've had to go through years of schooling and training to get to where we've gotten to. But sometimes what happens is that, sometimes people encounter struggles and they're not able to overcome those struggles, right? Like sometimes people just hit a wall and they're just like, they just can't go anymore. So to be able to turn your story, because I mean, you literally, you were wishing to be alive day by day. I mean, to take that experience where you could have become severely depressed and, you could have gone down a different path. You decided to turn that around to something positive. And obviously you didn't know what the outcome was going to be in terms of your own health. And then also the type of, kind of connections you would have made with other people and the effect that you would have had on a general audience. But obviously one thing, led to another, because you just wanted to have, a positive outlook on your life. And that's so incredibly important, I think, just to share with people. Right. And this kind of leads me to, my next question, our final question, is that, you've been through hell, Alin. You've already had two hip transplants. Who has hip transplants?
2 hip transplants and a heart replacement. Yeah.
It's late. Sorry, on a Monday. Hip replacements within just months apart in your critical care fellowship.
Right.
You still have a smile on your face today. You were taken out of your, residency because you had a heart transplant. You clearly have been through hell for a very long period of time. You're taking multiple medications every day, yet somehow you have this positivity, and I think we can feel it. Like you just are kind of this like ray of sunshine that you're just like, no, like I'm going to turn this into, no, but seriously, like I'm going to turn this into something positive. I'm going to try to connect with others. I'm going to show others I can be a badass physician, but then I can also, go through this. And what are the positive things that I can share with someone? And like I said, not everyone's able to turn that around within themselves. So how have you been able to manage your stress and anxiety? Because obviously, I'm sure there are days where you feel like crap, right? And so how have you been able to do that and then also be a physician, a trainee? And then for others that might be struggling with whatever unique situation they have, whether it's a medical issue or their mental health or whatever, what kind of advice would you give them to try to turn things around and maybe have a different outlook?
So we're all from California. So do you guys remember when I think it was Meta World Peace when he thanked his psychiatrist?
Yeah. Great.
So I always say that. I'm always like, I'm going to thank my psychiatrist and my therapist for getting me through everything because they are the best. I think mental health is the best thing you can do for yourself. I think having a therapist, having a psychiatrist, I mean, not even for this transplant, I think in general for life reasons, everybody should just be aware of that. You don't have to go every day, just have a therapist you can go to and talk about your problems. When you're getting ready for transplant, again, I'm sure you guys know this, but in general, you get a therapist, a transplant therapist who sees you regularly. They also see you after transplant. And I think they help me process my emotions very well. So there's that issue. The second thing that I did was I found what really helped me a lot was processing my emotions by writing. So that's how, when I got my blog, I wrote everything, and that really helped me. The other thing that really helped me, and I think this is just something, I don't know if I had it inside of me or if it, again, I think some people are just born with it. Some people just kind of develop it, but I attribute it to emergency medicine. I say when you're in emergency medicine, you kind of take what happens to you and you have to deal with it. And I love, and I think, and I remember the cardiologist said that I treated my transplant the way I treat emergency medicine patients, basically, because when I was there, they came in and they were like, your EF is 5% and this and this, and your creat is going up, and unfortunately you're gonna have to get a transplant. And they were very somber, and cardiologists tend to be a little more stern. And I mean, it was a very serious conversation, but for me, I was like, all right, let's get it over with. I got to get out of here.
Very methodical about it. Yeah.
I wasn't even I was like, this probably this can't be the first time this happened to somebody. You guys know how to treat this. We have this, so let's just do it and let me get out of here, and then I'll figure it out. So I think being in emergency medicine, where you're constantly dealing with stress all the time, the stress of having an MI, a stroke patient, and a gunshot wound in front of you all the time. And knowing how to deal with all three of those, you're not, you don't pick what's coming to you. You just get what's there and you take it and you deal with it. So that also helped, that mindset helped me. So I think again, just having somebody to talk to, having an outlet, like writing, and then just having that the way that I deal with things in general inside of me. I don't know how I have that. I think my personality kind of helps, also helped me. But, and I tell people I have a positive attitude, but I have my bad days. I cry all the time, it's not easy, but overall, I don't think that crying and being angry and worrying is going to help anything. And I think if you take those words and you apply it to any issue that you're having, that helps. Even with my hip replacements, at first I was really angry, but I'm like, all right, well, the anger isn't going to change the fact that I need my freaking hips replaced. So let me just get those hip replacements and go back to work. When you think like that, you it makes everything a little bit easier. And so it's very realistic, I think.
Yeah, I think some of the important things also is, there's the stigma, right? And especially with anyone who's in medicine, about sharing about mental wellness, about anxiety, about stress, because it's about taking it as it comes and dealing with situations. But I think one of the important things that you mentioned is about processing emotions, right? And I think that our field in general, all fields within medicine, can do a better job at maybe helping physicians learn how to process those emotions, because we put them to the side, we get what we need to get done, or we help the patient, right? And I think, in your case, you were provided with a therapist, psychiatrist, and these are things that in medicine are still considered taboo for physicians and students to have. But I think having these conversations like we're having with you and that you share on social media is starting to break down some of these walls that the field has created for itself, right? And so, yes, there's hard days for all of us in medicine, but it's about processing and learning how to process and giving attention to our mental well-being instead of ignoring it and pushing it to the side, and and talking about it and having the resources more available. So I agree. I think that by sharing your story, and not everybody has to share their own personal story, but sharing yours at least gets people thinking about their own ways of processing, and gets the conversation and the dialogue going. So at least if they can reach out and find what they need to find, it's something that's beneficial, and it was something based off of inspiration from your story. So I know that we both have appreciated you sharing all of those moments with us on Instagram.
Of course. No, I'm absolutely open to sharing, and I tell people it's all about processing. You're absolutely right. Mm-hmm. And it's I make sure, because when people say you're positive, I'm like, I'm positive, but it's because I process appropriately. And I don't like toxic positivity. I'm not like, oh, everything's fine. You're fine. Like, no, it's things are shitty sometimes, but
no, and like you said, you're just real. And I think some people just have it in them, and maybe it's just like you said, your EM training, where you literally, when shit hits the fan, it's like, I feel like we're cursing a lot on this thing. So I hope that the audience understands that we don't mean to curse that much. Sorry. I should put soap in my mouth. That's really bad. Anyways, but literally when shit hits the fan, what else are you supposed to say? I mean, you just got to do what you got to do. Like, you could sit and cry that you have to deal with like 50 million patients that you have to that are literally on the brink of death, or you just deal with it because you have to, because that's just your job, right? Or like you said, in your case, where, you were told that, all right, well, you're going to have a heart transplant, and everyone's kind of, super sad about it. You're like, all right, well, what am I going to have to do to get this done? Let's go, like how some people just have that, and some people are just born with it. And I think that, luckily that worked towards your advantage.
I actually remember when they told me that, like, because like there were people visiting me. So it's like, there's some attendings in there, like visiting me, and like my parents, like everybody else started crying. And then like, I felt kind of weird because I was telling everybody I was going to be okay. Like it has to be the other way around.
Right.
So I was like, I think I'm going to be okay, guys.
But I think it's important to point out, though, that it's okay for all of us to have those emotions, right? Like, you can cry, you can be angry, you can feel like you want to punch a wall. You can't, like, those are normal. And I feel like people talking about, emotions sometimes also say, oh, well, we can't feel. But no, we have to feel, but we can't sit in those feelings, right? We have to feel it and then process it and then do something about it.
Exactly. I remember there was a patient like recently, in the ICU, we have palliative meetings all the time. And so they get hard, but over time they get easier, because you're telling families that their family member is dying and all that, and you get to know the family. So sometimes it's hard, sometimes it's easier, but over time they get a little bit easy. And like recently I had a patient who I started crying like with the patient's family, but but they actually really appreciated it. And then afterwards, I was telling my own attending that I had started crying, and she was like, like, it's okay. Like, I'm very proud of you. Like, it's okay to cry. And I really appreciated that. So I totally agree with you. There's times where that just happens, and it's fine. Like, we can't, we're not robots. And
Exactly. So, Alin, the non-robot, we have talked about a lot of different things today, and you were so kind to be able to share, your story and about, your struggles and how you've been able to overcome a lot of that, and, have a different outlook to try to help as many people as possible. So do you have any lasting words that you'd like to tell our audience or share with our audience?
See, I think that I should definitely end with, I hope that everybody's signed up to be a registered organ donor. Just remember that one organ donor could save up to 8 lives and improve the lives of up to 75 to 100 others. So if you want to register at, if you're in the US, register at registerme.org. Thank you.
I love that.
I know, literally, we've never had anybody sign off like that. Maybe we should have more.
I actually say that at the end of every lecture too.
Oh, nice.
Are there a lot of people that are not organ donors? Like, I feel like that's just something that we just should be doing.
I think so too. Apparently, like there's a statistic that goes around, like 95% of people are for organ donation, but only 54% of the US is signed up to be. So I don't know how true that is, but who knows?
Yeah.
Yeah. Well, hopefully with messages like yours and advocacy like yours, we can get more people to sign up, so that people who are in need of organs like a heart, lungs, or whatever it is, they'll be able to get that. So with that, Alin, thank you again so much for joining us. And we hope you have a speedy recovery and you're going to be back to saving lives and kicking ass. We said ass multiple times. I'm sorry in this podcast. In the ICU. And again, thank you guys so much for joining us. Another episode of Heart to Heart, and we'll see you guys next time. Bye.